What does a person look like that doesn't have insurance? The reality is, they probably look just like you, but have different circumstances. There are 70,000 people that are without insurance in our valley. Antelope Valley Partners for Health began to address this issue 2 years ago with the AV Community Clinic Task Force, bringing together residents and providers, completing a community needs assessment to address the critical lack of healthcare services. Antelope Valley Community Clinic is the result of that community collaborative process, and it has accepted the challenge to take on this problem. This commitment is daunting, as our area is larger than the states of Rhode Island or Delaware and encompasses over 50% of the landmass of LA County. Given the current state of our economy, almost 70,000 people without insurance, the lack of care for the uninsured and underinsured shows greatly. We have the highest levels of infant mortality as well as the highest incidence of childhood asthma in Los Angeles County. To complicate matters, over 30% of Antelope Valley Hospital's ER visits in 2006 were used for non-urgent care services when these issues could have been handled in a primary care clinic. This clearly shows that overcrowding in the ER needs to be addressed. Antelope Valley Partners for Health has set in motion a way to overcome these problems: the Antelope Valley Community Clinic. This clinic will meet the rising need for primary care, dental care, disease management, prevention and educational services, as well as improve access to these healthcare services. Antelope Valley Community Clinic will encompass an expansion of Save a Smile dental program and continue to operate Caravan Mobile Clinic, as well as health programs such as Black Infant Health, Antelope Valley Best Babies Collaborative, United We Mentor, and the faith-based collaboratives. These existing programs provide critically needed health and prevention services for the uninsured and underinsured. The clinic is set into 2 phases. Phase 1 is 15,000 square feet and will be the primary space for clinical services including adult medicine, pediatrics, OB clinic, and dental services. With improvements of about $750,000 for construction and $365,000 for equipment and startup cost, a total of about $1,115,000 will be needed to complete Phase 1. Phase 2. The adjacent space in the building is 25,000 square feet and will serve as the home for a new community health and wellness center, provide opportunities for nonprofit subleasing, plus room for clinical expansion. The second phase will also include the first nonprofit education and conference center and a cancer support center in the Antelope Valley. Phase 2 will approximately cost an additional $1 million. The Antelope Valley Community Clinic is the real solution to the health, economic, and social problems that face our community. The need is there. The plans are in motion. Now, it's in your hands.